by the Erie County Public Health Plan. So now going into the individuals themselves, some of this information has been previously revealed. A male in his 30s with recent travel from New York City is currently in quarantine at a private residence. There's a female in her 30s with recent travel out of state is currently in quarantine at a private residence once again. You see, for whatever reason, our county feed is down. The third one is a female in her 20s with recent travel from New York City and is currently in quarantine. And the fourth one is a male in his 40s with recent travel out of state and is currently in quarantine at a private residence. So we have 7 confirmed cases of COVID-19 in Erie County. Every single one of them is in quarantine at a private residence. No one is hospitalized. If you notice, all of these individuals are younger. We've talked a lot about COVID-19 and its impact it could have on our senior population, and the individuals who have tested positive for COVID-19 are not of senior age. They're 20s, 30s, and 40s. This just goes to show that everybody went out partying and things like that, like, hey, I'm young, I don't have to worry about this illness. The only confirmed cases we have in Erie County right now are of individuals who are not seniors, who are in their 40s or younger. Everyone can catch this. Just because you're young and in great shape doesn't mean you can't catch it. Look at the NBA, the players in the NBA, some of the most peak condition you can possibly be. They've caught it. This is, as I said yesterday, the coronavirus does not discriminate. It doesn't care about your age. It does not care about your wealth. It does not care about your political affiliation. It does not care about your gender. It does not care about your race. It just infects people. And if you have it, even if you're not feeling a lot of the illness, you can pass it on to someone else who is at tremendous risk. Someone who may be younger, who's got an underlying health condition that they're not aware of. Someone who has issues with their immunization system, their immune system, and certainly with seniors and those over the age of 60. So we want people to understand that the 7 individuals in Erie County have it are not sitting in nursing homes. They're individuals who've been out and about in the community, and all of them, to our knowledge, caught it while on travel. We do not have evidence of community spread from an individual in Erie County to another individual in Erie County. Well, that's good. As I said yesterday, we are assuming it's everywhere. And to prove that, I'm going to announce the 4 towns from the individuals. There's one that's duplicative from yesterday. But in no particular order and in no order with regards to the individuals here, other than alphabetical order of the towns. We have 1 case that is now confirmed from the town of Amherst. 1 case would be the 2nd case from the city of Buffalo. A 3rd case from the town of Elma. And a 4th case that was confirmed yesterday from the town of Orchard Park. When we were talking about the public health lab testing capability, Doc will go into tremendous more about this. In total, 75 individuals have been tested in Erie County, 7 positive, as we know, 50 negative, 18 are pending. In other words, they're going on right now. So those individuals are being tested, and we're waiting for results on that right now. And I will turn it over to Doc Burstein. We'll fix our little thing here so you can see a lot more, to talk more about the public health lab actions that have been taken.
So, in response to the assumption that we have community transmission in Erie County, and there's really no reason to believe that we don't. We're seeing it in other parts of the state, very close to us, like Monroe County, and so we just assume that that's here. So we're offering individuals testing not only based on travel history, but also based on symptoms. And we have the revised protocols. The New York State Health Department pushed those out the other day, and so I just want to make you all aware of this. So the reasons that we will test, those individuals we will test, are people who have are close or any type of contact to a COVID-19 case. So it could be a close contact, somebody that, family member, a partner, somebody that you work with, or somebody that you could have been in a party at. so you weren't necessarily a close contact, but you could have been. So in those cases, we will test you. Somebody has the symptoms of COVID-19, so that's fever and signs of a lower respiratory tract infection, so an infection in your lungs, so that would be cough or shortness of breath, so you need both fever and cough or shortness of breath. And then anybody with a travel history to still those high-risk identified countries, China, South Korea, Iran, Italy, and Japan in the past 14 days. And so remember, if people fear that they are in the category that should be tested, please don't just show up to us or call our Erie County Health Department. What you need to do is talk to your healthcare provider and explain why you think you need testing, and then your healthcare provider will call the Erie County Health Department, and we will organize for those individuals to be tested. We will not do testing unless we have received authorization from the Erie County Health Department at the testing site, at the swab collection site, and that will only be obtained from the Erie County Health Department after a conversation with a healthcare provider. So do not go directly to the swab collection center or the public health lab. You have to talk to your healthcare provider. So now I want to talk about the isolation and quarantine. So as of 11 a.m. today, all 7 people who have been diagnosed with COVID-19 are in isolation. So that means that they are ill with COVID-19. We also have people who are going to be placed and are being placed in quarantine. So quarantine means that you're not ill, you don't have symptoms, and you haven't been diagnosed. Here we're talking about people who had significant contact to those individuals who we've identified with COVID-19. And those people are all going to be placed into quarantine by the end of the day after we get a hold of them. And we were obtained these names as a result of a very rigorous contact investigations from our 7 cases done by our Rockstar Epi group. So because there are like so many people that have had like maybe proximate contact, like just been in the same supermarket or been on the same airplane or been on the same train. There's like thousands of people. We cannot contact all of them. We cannot follow all of them ourselves. So what we're going to do is prioritize who we're going to monitor at the Erie County Health Department, and then everybody else, we're going to let the community know through the media, either through you all and social media and our website and our Facebook page, with the times and dates and locations of the places where we know the people who tested positive for COVID-19 would have been while they were symptomatic and able to transmit infection before they were tested. So we will let you know. However, we're not going to be able to call up each individual because you can imagine it's going to be thousands of people. So we are going to prioritize people that we are going to monitor. So check in with their temperature, check in that if they're feeling symptoms. So those are, family members, close contacts, or a partner, someone living with them or sees the case all the time. Our elderly or people with chronic conditions who could become very, very sick if they did become infected. And then our healthcare workforce, our healthcare providers, people working in medical facilities, all those individuals, like they can't go down. And so we have to make sure that we monitor them, to make sure that they stay well, and they also interact with many, many people during the day who are sick, so we have to make sure that they do not have a positive test. So, so what we're doing is asking the community to self-monitor. So, so people should just assume that you have been somewhere where you are very, very likely to have been exposed to COVID-19 in the recent past. And so we're asking people just to hunker down, stay at home, pay attention to your symptoms, pay attention to if you have a fever or a cough or any type of respiratory symptoms, and just stay at home and check your temperature, and really limit your travel, limit all non-essential travel. So essential travel, going to the grocery store or to the drugstore, or going to work. I mean, those are all things that we have to do. Going to see the doctor when you need to. However, going to randomly to like a movie or the theater or to a bar.
That ends
those are
after
going to
8
be
o'clock
closed down anyway, so we don't really have much of a choice. So we are going to tell you where these places are. So right now, I'm going to read the results of what we have so far from our latest contact investigation of where people have been who recently tested positive with COVID-19 in the community. And so individuals who fall in those categories where they may have been in the same place at the same time, they should go home and make sure they just stay at home and monitor their temperature and monitor their symptoms for cough or shortness of breath for 14 days. So on March 4th, anybody who was on United Airlines flight Eagle United from Austin to DC, so that's United Airlines flight 6028, and then also United Airlines 4810. We're going to put these on our website, so you'll have those. Also, on March 9th, Amtrak train number 49 that went from New York City and arrived in Buffalo around midnight. March 10th, the Galleria Mall. March 11th, to the Wegmans on Alberta Drive between 12 and 12:30 p.m. March 12th, to the Aldi's on Transit in Depew around 6:30 p.m. March 13th, the Rite Aid in Orchard Park on North Buffalo Road between 7 and 8 p.m. So those are the locations we've identified so far through our very detailed contact investigations. We will be having more every day. We might be having more later today.
For the people that are here, can you just repeat them starting again?
Yes, please do that.
Slower?
Okay.
Yes,
We-
please do that.
I just wanna let you- This is an example how it's so fluid. This information was given by our epidemiological staff, 12:50.
Right.
So we haven't
Didn't
we
have
don't
time
have
to
time
put
to
it
put it
in
in
the
a
PowerPoint.
PowerPoint.
Okay, so a couple of United Airlines flights on March 4th. The first is from Austin to Washington, D.C. on United Airlines flight 6028. And then following from Washington, D.C. to Buffalo on United Airlines flight 4810. On March 9th, Amtrak train number 49 that left from New York City and then arrived in Buffalo around midnight. On March 10th, the Galleria Mall. I do not have a time at this time. March 11th, the Wegmans on Alberta Drive between noon and 12:30. March 12th, the Aldi's on Transit Road in Depew at around 6:30 p.m. March 13th, the Rite Aid in Orchard Park on North Buffalo Road between 7 and 8 p.m. So remember, stay at home, hunker down, and know where you are. If you're at home or out in the community, at work, remember, we still have to continue with these non-pharmaceutical interventions. Quarantining, self-monitoring, closing down all the bars, the schools are helpful. However, the non-pharmaceutical interventions are extremely helpful. We can't forget those. We have to continue with good hygiene, good respiratory etiquette, staying away from sick people, and washing it down, keeping everything very, very clean. So, wrong way. So we have a way for people to get good information, not from Facebook Boy, but these are from good, credible sources. So we have our Erie County COVID-19 hotline at 716-858-2929. You can imagine it's been very, very busy. You can imagine when this broadcast is over, it's going to get even busier. So so people are going to expect, if they call, they're going to have to wait. We have many, many people deployed throughout Erie County government to come and work with us to man the phones. We're getting hundreds of calls every day, and there is going to be a wait. So we're asking you to ask like real questions about a real situation, not hypothetical questions. We need like real people. We're asking for people to call if they have real questions about real situations, about themselves or their family members. If you have any questions about your own personal health, we can't answer everything, so call your healthcare provider. Also, there's some great online information that may have all the answers to your questions already. And those are on our Erie County Health Department, our Erie County government website, our eriecounty.gov/COVID-19. Also, the New York State Health Department and the CDC have websites devoted to COVID-19 with a lot of great information. So, you know, you're hunkering down, you have time to kill, do some reading.
Thanks, Doc. As we all know, I declared a state of emergency in Erie County effective as of noon yesterday. Ordered the closure of the schools for today. Yesterday, after the press conference that we had, Dr. Burstein and I were involved in a conference call with the superintendents from all of the school districts in Erie County. We gave them our best information that we could with regards to where we thought this was going. They were asking for assurances on a timeline and when we would be able, when we know we'd be through this, and we could not give them an assurance. They're hopeful that it would be as soon as possible, but we could not state to them that it would be a week from now or 2 weeks from now. And as a result, they made a decision to, as you all know, jointly close the schools through April 20th. As a result, we are thankfully not having to deal with the schools being open, but there are specific issues that are a result of that, of course, from parents needing to find the location to put their child during the day if they are an essential employee. And that's why Deputy County Executive White, as well as Commissioner Cannon, are working with a task force right now of county individuals, as well as folks from outside, including the Buffalo Niagara Partnership, I believe, and some other organizations to find locations that can be utilized for daycare for first responders and essential personnel for governmental purposes. Also yesterday, and I'll turn it over to Chief Scott Petronic from the Sheriff's Office to give a little update. As you know, we were having a lot of problem with some of the bars in the afternoon. St. Patrick's weekend, and a lot of them were still partying pretty hard. And as a result, Buffalo PD and the Sheriff's Office went out, including with sanitarians. So Scott, would you like to kind of talk about a little bit of what the protocol was and what ended up happening?
Thanks. Yeah, we started getting several tips from the public on numerous locations that were basically just bluntly violating the act as far as the number of people they could have in their facility that was cut down yesterday. At that time, it was 50%. People were just totally ignoring it. They were even over capacity on the original calls. We ended up setting up a task force and with us, local law enforcement partners, and Erie County Health Department with full intentions on going out, and the Health Department was going to issue closings for those facilities. We checked about 24 different bars and restaurants. The task force ended up getting set up and spun up after we received these complaints in the evening. By the time we got out, it was about 5 o'clock. We worked through the evening hours, checking about 24 locations, and at that point they were all abiding by the recommendation of staying 50% or under capacity. So we were happy to see that, but again, we're in an atypical situation. We are not going to be tolerant of people ignoring these requirements. Whatever gets pushed out by state government, county government, health departments, if they ask for our cooperation, we're going to be cooperating. And if they decide they're going to close a facility and they need us as a partner, we are going to partner with them to make sure that these are enforced. You know, this is something that's not typical that we're used to going through in an operation, and we're just asking for the public to cooperate, right? This is going to be something we're all going to get through together, but we're not. It's just like a winter storm. When we ask people to stay off the roads, we could actually get onto those roads, plow them, open them much quicker, and it's a benefit to everybody. When we start to get cars clogged up on the roads and we end up having to tow cars, etc., it takes a longer time to open the roads just because of lack of public cooperation. And it's the exact same example here. We need to slow this spread, and the way we're gonna slow it is listening to the experts with their health guidance, and we're gonna cooperate with them any way they ask to make sure that these are enforced.
Thank you, Scott. I've been in touch with Sheriff Howard, and been in touch with other local officials, and I do thank them for the seriousness that they understand this situation is and the actions that they took yesterday. I do believe one of the reasons why, when we went out and we're finally out with sanitarians and law enforcement after 5 o'clock, it's because of what was done earlier, which was not only the condemnation of it, but also the social media shaming. There were a lot of locations that were being identified as social media shamed. And when the Buffalo PD went out and some of the town law enforcement went out in the afternoon and said, you're gonna get shut down, you're gonna get reported to the liquor authority. By the time we got there with the commissioner orders in hands to shut them down, they had actually followed the 50% or below standard, so that's good. But as we know, that's kind of changed now because effective as of 8 o'clock tonight, Governor Cuomo, in concert with the governors of New Jersey and Connecticut, has ordered all events, crowd capacity to be no more than 50. That restaurants and bars will be takeout only or delivery. And that includes every size establishment, from the largest one to the mom and pop that might only have 4 stools at the bar. We still have a few of those in Buffalo. Every one of them. You are no longer able to open and serve alcohol inside your premises or serve food inside your premises. We are still getting guidance on this. We are, like many of you, waiting for guidance from the state, but it is effective as of 8 o'clock tonight. And I was advised that the state liquor authority will be going out in our region to confirm that bars and restaurants are following the order. And you really don't want to have them issue a citation in this situation. I was told yesterday that in yesterday's situation, and this is before the governor's order earlier today, a first violation would have resulted in a $10,000 fine. A second violation would have resulted in an application to remove your liquor license. Take this seriously, owners of establishments. We're going to give you the full guidance when it's available, but we want everyone to take it very seriously. And then, of course, the gyms, movie theaters, casinos will be closed effective as of 8 p.m. today. I imagine that also applies to Chuck E. Cheese's. So we are all in this together, which means we have to follow these rules. I know people aren't really happy about it, but if you're one of the individuals who has COVID-19, who's in isolation in your home right now, you're more worried about what's the end result of my physical well-being going to be, not if I can go to a Chuck E. Cheese or a movie theater or go get a fish fry on Friday. This is much more important than that. So I want people to know that we are taking this very seriously and working with our partners in government to enforce the law. While this is not a portion of the law that enforces the law, or department that enforces the law, our Department of Homeland Security and Emergency Services is a key department during any situation, but especially this, with regards to coordination of local agencies and ensuring that what needs to be done is done with regards to the services that have to be provided to the greater community, as well as the enforcement of what county and local governments are trying to work together by working with our local law enforcement. I'd like to give our Commissioner of the Department of Homeland Security and Emergency Services, Dan Nerford, an opportunity to speak at this time. Commissioner?
Thank you, County Executive. Good afternoon, everybody. Just a quick update. We talked about this last week. Currently, we are operating under a virtual emergency operations center. That means that our disaster land is up and running. Every town, village, and city within Erie County has access to that. And that's critical because not only are they given situational updates with regards to what's going on in the county and the other communities within Erie County, but I think more important than that, it's also an avenue for them to be able to take a look if they have requests specific to things that are outside of their normal supply chain availability. but that's how they do that. So any of these processes, just because this is something different than a storm we might have had in the past or Flight 3407, the process is still the same. And I know a lot of people are asking, well, how come the Emergency Operations Center, which is a building, has not been activated? But trust me when I say there's a lot of activity that's going on. We are practicing what we're preaching with regards to the social distancing. So not only is this building right here and many, many of the floors within this building, the people that are normally assigned to those are doing what they need to do. So we also have a health operations center that's been up and running. That's the process of these drive-through clinics and all of the testing that's been done up to date. We have an active incident command structure that's been put into place. And the charm of that is it brings into all of the participating agencies that actually have to be there to make decisions, planning, logistics, finance, operation, those day-to-day operations have been up and running and continue to be. But we also are taking very seriously this. We're not putting 100 people into individual rooms. We now operate under what are referred to as emergency support functions, whereas the conventional wisdom would be we need 50 more people or 200 more people to manage this. What we're doing is we're taking the appropriate people and we're taking those emergency support functions and we're pushing them out to much larger groups in the community. So be they transportation, be they food supply chains, the electrical system, any type of those mass transit issues that we have to deal with. Those are all parts of ESF that are managed individually through small groups, pushed out to the people that actually control those on a day-to-day basis. We are in contact and have been in contact with the utilities this morning. Traditionally, they provide a liaison to our facilities, but our mantra here and our big push is to make sure, keep the lights on, keep things going, keep your continuity of operations going. We don't necessarily have to have a person standing alongside of us from the utilities in order to get our information out. Those are the relationships that have been developed over many, many years, where we can pick up the phone if we have an issue and we can make direct contact to the president of National Grid or of NYSEG. We don't have to have a representative that's here. So think in terms of virtual, and I say that because there's a lot of businesses out there that are trying to think in those same terms. There are a lot of restaurants out there that are trying to think in those same terms. There are opportunities out there. We realize everything seems to be restrictive, but working within those confines, our emergency preparedness group here, our command structure, and all of those that are directly involved with it are trying to come up with creative ways of working through some of these processes. So if your restaurant is closed, but there still is takeout and delivery, how can we make those modifications? If we need to address certain laws maybe that need to be adjusted under a state of emergency, that's what the state of emergency and emergency orders are for, to be able to work through some of these common sense things so that there aren't irrational obstacles in the way to accomplish whatever we need to do. So fully functional. I will leave you with this. I wanted to mention yesterday, when we have a command structure, we prepare an incident action plan so that all of the participants within that structure know day-to-day who's answering to whom and what their responsibilities are. What is your mission for this operational period? And the reason we do is because at the end of the day, we take that back. And our primary principles here with regards to the incident command system are, at the end of the day, if we look at a document, are we making it better? Is it staying the same? Or are we making it worse? We reevaluate that, we address it with the policy group, and then the next day we come at it from a different approach, or we keep going full steam ahead with what we're doing. So I just wanted to kind of give you some of those basics. The bread and butter is quite frankly, for most people, the boring aspect, but there's a lot of action going on behind the scenes here and a lot of personnel that are really working day in and day out to make sure that we get through this as quickly as possible.
Thank you, Dan. I want to thank Kendra and Jen from Deaf Access Services who've been providing American Sign Language for the individuals who are watching at home. Thank them. And as you see, we have 2 today as compared to 1. I think we just about tired out Karen Gambino yesterday. And I know we're going to have a lot more to say with regards to question and answers. I do want to ask people to patronize local restaurants by ordering takeout or delivery. The super national chains are going to do just fine in all likelihood that you see in the malls. It's the mom and pop restaurants, the small locations, maybe 2 or 3 in this area, but they're based here. We're asking people to truly patronize them. They're going to be going through very difficult times as well as their staff. We know a lot of other people are going to be doing the same thing, but we're going to try to ensure that these local restaurants still have the ability to exist, because this This is something that could shutter a lot of restaurants based on, this is an extended period. So we're asking people to continue to order for delivery or takeout through local restaurants so we can keep our local economy and individuals going and hopefully allow these restaurants to survive what could be a very long period of time. And with that, I'll open up to any questions.
Mark, as you search for daycare centers for government workers, healthcare workers, do you have a working percentage or number of total workers that will need to find some sort of daycare place for their kid?
I would probably defer right now to the Deputy County Executive, Marie Cannon. I don't think we can give you an exact number on that. We're trying to identify that right now. What we're doing internally is identifying what we need. We're also reaching out to some of our other fellow parties, governments and first responders to find out what they need. Of course, we have to put facilities in the communities themselves. If someone is a first responder and they have to be out and they live in Sardinia or Concord, having a location in Tonawanda is not going to be useful to them, so that's all part of the discussion. I don't think we have a full number at this point.
And just as a follow-up to that, do families who say they have their kid already in a daycare place, do they risk their kid losing a spot to first responders or government workers?
What we're looking at right now is creating new facilities in some locations. Some have shut down. There are some that we've probably known have learned have shut down on their own. And as a result, we're reaching out to them to find out if we can use their facility for a location. But it's all a work in progress. Steve?
In regards to testing, multiple questions. Is the protocol still the same that the doctor has to come through, the testing has to come through a doctor conversation with the health department? What happens if this person does not have a primary healthcare physician? And also, what's the monitoring that's going on with the folks that were in these locations that you mentioned?
So the questions are about testing and monitoring. So so we are still asking Erie County residents who are concerned that they may require a COVID-19 testing to be identified to go through their healthcare provider, and then the healthcare provider will contact the Erie County Health Department and will make a plan for the specimen to be collected and the test to be run. If a person does not have a primary care provider, they can call an urgent care center. Please don't clog up the emergency departments. They can call an urgent care center and talk to them, and that urgent care center can call us. And so in terms of the monitoring, so for people who are, of course, everybody in isolation is going to be monitored. Everybody who we are following under a mandatory quarantine is going to be monitored by us. We check their temperatures. We give them a temperature log. We ask them to document their temperatures twice daily. We check in with them twice daily, one in person. We like to wave outside so we don't have to come in. Just checking if they're okay with any symptoms of cough or shortness of breath or fever, if they're doing okay with food, if they're going okay with mental health, just checking in like that. Other individuals that have been in the community and may have been potentially exposed because they were in the same place as we've identified a case of COVID-19. We are asking those individuals to go home and quarantine themselves and monitor themselves. So we're asking those individuals to stay at home for at least 14 days after that exposure, check their temperatures twice daily, check in with themselves twice daily, make sure they don't have a new cough or shortness of breath. And if they do, contact their healthcare provider or an urgent care center and let them know, and then we can organize a test for them.
You said Galleria Mall that one day, so anybody who was at the Galleria Mall on March 10th, you want them to quarantine for 14 days?
As of now, that's the information I have. I'm going to, our EPI team is going to try to get a better definition of the time, and we will post that, we will send that out to you.
But anybody who was at the mall on that day, just to be clear, you want them to be at home for 14 days, anyone who's at the Galleria on the 10th?
Right, as of now, with the information that we have.
Do they
Hopefully I
also
can become more specific with the times.
Do they also contact you if they're self-isolated? Do they also contact the health department, or do they only contact the health department through a doctor if they're symptomatic during that self-isolation?
Yeah, people who are in quarantining themselves and who are self-monitoring, should only call their, they can call the Erie County Health Department if they have symptoms. And it's better and more direct if they call their healthcare provider, and then that's a straight shoot to getting testing.
Do you not want to know how many and who they are until a doctor contacts the health department?
You know, there are thousands of people, we believe, in our community that have been in just the few locations that I mentioned. And so we just don't have the capacity at the health department to follow all those individuals. So we have to prioritize. We have to prioritize to the people that we know had a very close contact, and so there's a very high chance that they could be infected. We have to prioritize, we know people who could become very, very ill if they were infected. So that's the elderly and people with other chronic conditions. So that's what we're doing, is prioritizing, because we can't follow everybody.
Just to be clear, the people who tested positive are in isolation at home, they are not hospitalized?
Right, so far, everybody who tested positive is well enough to remain at home for their isolation.
No one's being treated at all in any hospitals right now?
There may be people in hospitals now that have COVID-19 that have not been identified. However, we do not have any positive cases where the person was hospitalized.
And we have tested individuals who are in hospital right now that we thought, based on the information we received from the hospitals, were prime candidates for COVID-19, but they actually turned to be negative.
Right, we're testing from everywhere, all the hospitals, every site.
So you previously talked about the limited capacity that the health department has. You guys have 3 epidemiologists on staff. They're the ones who are primarily responsible for tracking all these folks. Yesterday you said you guys were hoping to have like an hour-by-hour breakdown, and like maybe they could go help find these folks, but it sounds like you guys just are very limited in terms of your ability to actually go proactively track down these folks, which is why you're asking for help. What steps are being taken to actually bring more people on board so that you have the capacity to do more tracking? These numbers are only going to grow.
Right, you're right, these numbers will grow. Fortunately, we have hired some contractors. We have some great volunteers from the academic community, the healthcare community, from other parts of Erie County government. You know, people are stepping up and helping us not only on the epi side, and also on the phone back time. But again, because we're getting hundreds and hundreds of calls every day, so we are it's all hands on deck, and we're training people every day to come work with us, and we're getting the job done. But again, with thousands of contacts, and these could be people from all over the United States with the plane and the trains, and there'll be more that we just can't possibly contact all those people.
The one thing I will note is we have other resources internally in the Erie County Department of Health that we have transitioned to basically being epidemiologists, such as nurses from the the William Street location, the sanitarians who have the background and the experience to go out there that could actually do some of this contact tracing yourself. The 9th floor is absolutely madhouse right now, with nurses, epidemiologists, other staff from the Department of Health, account clerks that have been brought in, clerks from my office to help answer the phone. But I don't want it to be think that there's only 3 people doing this. There's many, many more. Our budget only has 3 epidemiologists and the chief epidemiologist, so 4 people in total. But right now there's dozens that are doing the work. Our fear and what we saw based on 2 flights, United Airlines flights, a train, the Galleria Mall on a particular day, a Wegmans on Alberta Drive, and we know how busy that one is. Even if it's only a 2.5-hour period, it's one of the busiest Wegmans in the region. And all these are Rite Aid, is that there are thousands of potential contacts out there right now. That's why I've been saying we have to go under the assumption it is everywhere. There are people who are probably feeling wonderful, who may, in the next few days, not feel so good because they came in contact with an individual at one of those sites. So we're telling everyone, that's why we're taking this as seriously as we are, and the protocols are being put in place. Because while there are 7 positive identified cases, there are probably many more cases in our community. And all you have to see is what's been going on in other communities that had earlier cases. Now they're seeing exponential growth. George.
Can you give us an example of where you draw the line of actually reaching out to somebody to let them know they may have come in contact, or just considering it a casual contact? So an example of either a cubicle away, 2 cubicles away, or if I said something to somebody in the next aisle at the store, is that enough for me to call that person? Where do you, and I'm sure you have this judgment call all the time, so give us an example of how far is so close that you actually, somebody calls that person?
Sure. Well, a close contact is, again, like a family member or, a partner or, a coworker that you sit close to. We usually say, 6 feet, within 6 feet distance is a close contact. Also we are prioritizing people who could become very, very ill with COVID-19, like the elderly or people with chronic conditions. So those are the people that we're prioritizing to contact and for us to monitor. And then again, the people who have recently traveled from these countries of high risk, and that's dropping off now because the travel from those places are limited. Those are also people that have a very high likelihood of becoming positive, and so we're also following those individuals.
Are you a little bit encouraged, at least today, that the numbers aren't much worse than yesterday? Like, you tested all those people, and were you a little surprised that it's still only 7?
For a disease investigation, this is a massive amount. I mean, it takes about an hour to explain to an individual what their test result is and it means if it's positive, and then to do the contact investigation. I mean, that could take a day or more for each individual. So this is a huge task. So, and then 7 is more than twice as much as 3. So it's, it is growing exponentially. So, and I imagine it will continue to grow.
And I would note, we did a lot of tests yesterday. We only did 9 on Erie County residents. 3 came back positive. 33% of the tests that we did on Erie County residents yesterday came back positive. If we had the capability to do 1,000 tests on individuals that fit the protocol, I don't know if it would be 33%, but I'm fairly confident there'd be a large number that would come back as positive. I'll go back to the next.
So the governor announced just before we came out here that he's forcing governments to limit their workforce by 50%. So how is that going to affect? I know you asked for more money to increase staff, especially with the call center, police force. How's that going to play out?
Well, we're going to be spending a lot of money, even regarding this situation. Actually, I was on the phone with the president of the National Association of Counties. Actually, I should say the chief executive officer of the National Association of Counties, Matthew Chase, about 2 hours ago, as he was requesting from me what he thought would be our needs with regards to overall cost in the long run associated with this. And we talked about the possibility of having to reopen health facilities that have been previously closed if we had a major outbreak and we had to put people into other types of facilities, additional staff. His words to me is, Mark, this might be one of the biggest bailout bills, so to speak, the federal government has done in a long time. Hundreds and hundreds of billions and maybe even more. What we are going to require is still out there. We're not certain, and we are waiting for official guidance from the state on the 50%. I'll give you an example. We have sewage treatment facilities. They can't shut down. You can't shut down a sewage treatment facility. I think we all know what will hit the fan then. We don't want that. So we're not shutting down sewage treatment facilities. Our health department, we're not shutting down the health department, and we're not going to cut from the health department. If anything, we're going to be hiring more people. As we sent over to the legislature today, as you remember yesterday, I asked for emergency $5 million in funding. We sent over to the legislature that request today, which would give us the power to purchase equipment, to hire more people, whether it's fee for contract or actual employees, so that we would not have to go through the normal protocol. So we are going to be looking at it on a department by department basis. There's certain departments that probably will not need to be in existence for a time during an emergency situation, as we are right now. And there are others that will be, but on a reduced staff. So we're looking at all different areas. I mean, right now we're on the floor of the Public Works, and there's aspects associated with Public Works which must go on. But the nice thing is there are also a lot of those Public Works employees are out at separate locations, at different barns, where they may have less than 50 people to begin with in the barn, and they work on shifts. So we're going to have to determine that throughout. But yeah, there's certain departments that will probably be heavily reduced. We know that will have a tremendous financial strain on families, and we're talking to the state right now as well as our federal representatives about what assistance there could be. I mean, we know that there's a discussion with regards to providing assistance to individuals, but that has not been approved yet. If somebody has to file for unemployment, that is still gonna be ongoing with New York State, and you can file online through the New York State Department of Labor office. So we want people to understand that government will continue. It may be in a different form, and there are aspects of it that will change, but government will continue, because there's certain services we still have to provide. Sam, next.
So,
Dan wants you.
And just to reinforce, the county exec did mention over the last several press conferences that every department within county government was given the directive of coming up with their continuity of operations plan. And that continuity of operations plan specifically, a week ago, addressed something that could potentially be as draconian as what we might be facing with that. Further to that, Central Police Services, working in conjunction with a lot of the other agencies, especially from the dispatch standpoint, work proactively. So based on our redundancies that we have built into the dispatch center, for example, what we are doing now is we are proactively starting to isolate, social distance dispatchers, call takers, and different agencies now will be separated into different parts of the building so as to continue that operation, the continuity, and then from that point on, isolate people so that the services can still be provided, just a different way. They'll just be on different floors and in some cases different locations. So the continuity of operation isn't something that's new to us. The directives that are coming out now are just pushing that forward.
And I'll say this for the county employees, I know many of them are working today, others are not. We often get questioned, well, am I an essential employee? And your department should have identified that before, and we have a list of it, but there's always a good way to tell. Here's my employee card. Flip on the back, emergency travel authorized. If you're an employee and you don't have emergency travel authorized, you're not an essential employee. Next question.
just to get back to the issue of people who you want to self-monitor, if they have, if they're at one of these public places, when you say self-monitor, are you asking them to be in voluntary quarantine, and are you asking only those individuals to be in voluntary quarantine, or anyone else they might have been in touch with? Because we're already talking about, hundreds or thousands of people. So if you could provide a little more clarity what you mean when you say self-monitoring, when you do have like the final list of all the public places these folks could have been, that would be helpful.
Right, I mean, I think at the end of so the question is like who should self-monitor? And I think at the end of the day, we should all self-monitor because we have a list of places where we know somebody with a COVID-19 test was at during a time where they were symptomatic and they could have transmitted infection. However, we assume there are a lot of other places that we could have been to where people could have been exposed to people. Somebody hasn't been identified. So what I mean by self-monitoring is that everybody should be taking their temperature twice a day. Everybody should be checking in for symptoms, and they should just stay at home. There's really nothing to go outside for right now anyway. And so we really asking all Erie County residents to again to be part of our effort to decrease transmission and just think about monitoring yourself for possible infection.
So is that a quarantine or not?
Again, it's a voluntary quarantine. We're asking it to everybody to voluntary quarantine, stay at home, stay away from other people if possible. Again, it's the opportunity for us to make smart choices and enhance our physical distancing to be able to decrease the risk of transmission. So that's one of our non-pharmaceutical interventions. Again, when we believe we have widespread disease transmission in our community, we have to take these extreme measures and just have to make these assumptions that anywhere we go, we could be exposed. And it's going to be difficult for everybody to stay at home all the time. We have to go grocery shopping. We might have to go to, people are still going to work. People have to go to see their healthcare provider. So, we are going out, and and it's impossible for everybody to stay in all the time. And just be realistic what the risks are.
Two more.
What's your suggestion for people maybe wanting to use parks and things like that? Is that still okay to go outside in those areas?
And like malls too.
Well, I would not go to the mall.
Is it gonna be shut down?
I don't know. We're talking right now with the state and getting more information as to whether those type of locations. Mall is, well, there's not a ton of people generally congregating in one location at the mall. Those may be shut down. Parks are still open as it is. I mean, we shut down anybody, I should have said this earlier, anybody who had a reservation at one of the Erie County parks, Your reservation is being canceled, and your money will be returned to you. The parks are still open, and it is okay to go out with your immediate loved ones and so forth, and actually, like, go for a walk. We're telling people and reminding parents, if they send their kids to the playground, they better be wiping their hands and stuff like that, because if they're gonna use playground equipment, it's gonna probably have germs on it and potentially the virus. So if you're gonna have your kid out there, that's maybe not so good. If you've got a baseball bat, ball and glove that's yours, go out, play catch, play football, play a little catch football amongst your family members. But I wouldn't get the whole team together. Like when I was growing up on Della Drive in the Ludell neighborhood, and we would all come and play football and street hockey and stuff like that, I wouldn't recommend. But the parks are open, and go out for a hike. And a lot of people were actually, I was reading over the weekend, were going out for hikes, and that's not a bad thing to do, because I think we're gonna need to get out of the house and be able, from the stir craziness that does exist. Yeah, George, last question.
Just to clarify, if anybody was on those flights, it was 12 days ago. So they really only have 2 more days to show symptoms, is that right? That if they were on the flight and they're not showing symptoms, in another 2 days, which is day 14, then
Right, right, and, we usually see symptoms develop, sometimes between, 5 and 12 days. However, they could be an outlier and go to 14 days, and they may have symptoms now and not really thought anything of it. And so now they'll know that these symptoms could be a sign of COVID-19, and they really should get tested.
Okay, of course, we'll update things through the internet. This is totally evolving, completely evolving with the situation. We'll constantly be updating. We are considering, when we talk to media representatives, we are considering on going to a video conference instead of an in-person conference, which I believe will actually be easier for the stations, but we have to be able to ensure we have the technology to do that rather than doing an in-person conference. And I just want to send one more statement to my mother, who's in Florida. Andrew Cuomo, maybe the governor of New York State, but he's been yelled at by his mother, Matilda Cuomo, and my mother scolded me for touching my face a number of times during the press conference yesterday. Mom, I did my best. I have a terrible itch on my nose. As soon as I'm done, I'm gonna itch it with my sport coat. But wash your hands, try not to touch your face, otherwise your mom's gonna scold you like my mom did yesterday. Hi, Mom and Dad. Take care, everyone.
We're all in this together.
Should we expect an update around 7 o'clock, because that's been the pattern of